to make your painful conditions better. So regenerative medicine, people consider this as a broadly deals, basically it's using biologicals or the biological materials to stimulate your own body's response to heal itself, instead of using the medications or even the surgeries nowadays. So regenerative medicine has two components. We mainly use a platelet-rich plasma and other thing called stem cell based therapies, and we'll go more detail about that. So one of the Americans for Cures Foundation had this statement that stem cells hold the promise of the treatment and cures for more than 70 major diseases that affect millions of people. So we go over the platelet-rich plasma first. So what is platelet-rich plasma? Platelet-rich plasma contains supraphysiological concentrate of platelets in a small volume of plasma. Normally in your blood, usually you have 150 to 400 times 10⁻⁹ per liter platelets, the number of the cells in your normal blood. Platelet-rich plasma has 4 to 8 times of that numbers. So what are the platelets? The platelets is the smallest blood cells in your blood. It's like red blood cells, white blood cells, and the third one is platelets. They function they have lots of functions in your body. You know, they can coagulate, they get together, form the blood clot. They can also lyse, and then basically releases lots of growth hormones that helps to heal the tissues. That's what happens when you have the cut in the skin. The platelets gets really activated to basically start the healing process. They derive from the bone marrow. Bone marrow is in a many your bones. In the middle of the cavity there is a bone marrow. So they basically form there from the other parent cells. They synthesize and release large amounts of biologically active proteins. Those are responsible to start the healing process and eventually formation of the normal tissues. Their average lifespan is 5 to 9 days, so you can imagine they keep getting formation all the time. You know, lots of platelets gets formed, and they are the natural source of the growth factors. They contain 3 types of granules responsible for synthesizing different kind of growth factors, alpha, delta. It's too much chemistry, biochemistry. Over 1100 types of proteins inside the platelets. One platelet can contain 1100 types of proteins. So all proteins helps to heal the tissues. Growth factors derive from the platelets. What they do, they usually stimulate cell replication, so they allow the normal cells to get more and more cells coming to form the tissues. They promote the angiogenesis, new blood vessel formation. That's the vital to heal the tissues. You need the blood to bring more nutrients, basically to heal that's something damaged. So they form more blood vessels, and that's how the more blood comes and it heals more. Promotes the tissue granulation formation. That's the basics for the tissue healing again. Promotes the growth of extracellular matrix for the stability. And the local application of those growth factors in higher concentration can be done by injection of platelet-rich plasma. And we'll go more detail in that. Platelet-rich plasma also has antibacterial effects. Platelets and leukocytes, that's the white blood cells, can release variety of the antibacterial peptides that can kill the many bacteria too. Those peptides promote, basically kills the bacteria, so it also helps for any infection. Healing process may result in one of the following outcomes. So if you have injury, if you injure the tissue, 3 things gonna happen. Either there is a scar formation, means it's a non-functional tissue. If there is a scar, it's useless. It's not gonna function, it's just sitting there. You have partial formation of the tissue. It's again not functioning, it's non-functional, really no use to the normal body. And then normal tissue formation, that's fully functional tissue. So these 3 things can, one of these 3 things can happen when you have injury. So platelet-rich plasma, so platelets involved in many phases of tissue healing, and they are critical in normal process of repair and regeneration. So if you imagine that if you inject platelet-rich plasma with lots of platelets in that injured tissues, it's going to heal very quickly and very normal fashion, compared to if there's a tissue damage, you have bloods not coming there, you don't have the platelets coming, you don't have the growth factors coming. So when you inject the platelets right there, they can release all those growth hormones in a huge volume, and that can help, you know, promote the tissue healing very quickly. Because you have, let's say, a scarring there that's not helping for the blood to coming in, the tissues inside is just suffering. So how we get the platelet-rich plasma? Basically, we draw your own blood, and then we spin in something called centrifuge at this certain speed, certain gravity, and when that happens, there is a separation of 3 layers. This lower layer is basically all red blood cells. This is called little bit of white blood cells there, and then there is a buffy coat that's rich of platelets, and then you have your own plasma. So what we do for the seconds, we do the second spin. From the first spin, basically we discard this, we take this good stuff from the buffy coat or platelets, and then we put in another tube, and we recentrifuge again. And what it does, it actually gets lots of platelets in the bottom here, and that's what we usually take out of the tube, and we use that to inject. This is the fluid that's lots of platelets in it. So it's a two spinning process. So the final product is like this. That's platelet-rich plasma. After we getting the platelet-rich plasma, we inject in the intended tissues, intended joints, intended muscles, tendon. The most important thing is to use some kind of guidance to do the injections. You know, you have to inject in the tissue that's injured. So you cannot just guess and inject anywhere. It's not going to help. You have to put it in. So if you're injecting the joint, you have to make sure it's in the joint and not outside. If you inject in the lumbar disc, you have to make sure your needle is in the disc. By injecting in the muscles by the spine, not going to help your disc, not going to help your facet joints. So you have to make sure. So we always use either fluoroscopic guidance, X-ray guidance, or ultrasound guidance to inject it. And that's the only way you can be sure that it's right where it is. Otherwise, it's not going to help. Stem cells. Stem cells is a whole different story. These are the parent mesenchymal stem cells. They are the backbone of the tissue generation since you get born or since you become the embryo. So stem cells help create new cells in existing healthy tissues and also help repair tissues in those structures that are injured or damaged. So stem cells, mesenchymal stem cells, we call, they are like undifferentiated cells. Means they are just normal cells, but they have the capability of differentiating in a different tissue forms. So if you inject them in the bone, they will differentiate and multiply in the bone cells to generate the bone. If you inject in the tendon, they will differentiate in the tendon cells to generate the tendon and muscle. If you inject in the fat, they will convert in the fat cell and cause more fat. So basically, they will differentiate in the cells needed or in the tissues you inject. So that's the best quality of those stem cells. They are designed to target areas within the damaged tissue to help with the creation of new cells. As mesenchymal stem cells are multipotent, they have the ability to differentiate into the specific tissue type cells. So if you don't do anything, just leave them alone, they won't do anything. But you inject in the particular tissue, they will convert in the same tissue, as I said before. They're also anti-inflammatory and can assist to reduce the pain and swelling. So when you have the chronic injury and there is a scar formation, there is a chronic inflammation there. So you're constantly having pain there because that inflammation is not going away. So scar tissue is just hurting and hurting. It's not getting better. So when you inject the stem cells, basically they take care of that inflammation portion too before regeneration starts. Three types of stem cells usually: embryonic stem cells, induced pluripotent stem cells, adult stem cells, also known as the mesenchymal stem cells. We usually don't use the embryonic stem cells. Embryonic stem cells are known to cause the tumor. So if you inject the embryonic stem cells in someone, they will lead to the tumor formation. If you inject these adult stem cells, mesenchymal stem cells, they are known not to form any tumor. What we use: adult stem cells. Autologous source means your own. The sources are usually bone marrow or adipose tissue. The stem cells are everywhere. They are in your blood, in your bone marrow, adipose tissue, in your tendon, everything. It's saying where you can harvest from. So the bone marrow and the fat or adipose tissue are the commonest one you can harvest easily. So again, they function as a repair, restore damaged tissues. Again, they stays in an undifferentiated state once they form. So once they form in the bone marrow on adipose tissue, they just stay there like that, dormant, doing nothing. But once you transfer them into other tissue, they start differentiating. So how we collect the stem cells? Usually bone marrow aspirate. So basically we collect from any of your bone. Any of the bone has bone marrow. Wherever the bone marrow, you have vertebral body that has bone marrow. You have the long bones, your femur bone, your thigh bone. The most commonest place to get is from your hip bone, the iliac crest, right here. Easiest way and very fast procedure. What we do, once the stem cells are collected, same as the platelet-rich plasma. Platelet-rich plasma, we draw your blood, we centrifuge. For the bone marrow, most of the time, we aspirate, we centrifuge, and get the concentrated mesenchymal stem cell fluid from the bottom, same as the platelet-rich plasma, and then we inject that. When I do the procedure, I have a special needle. I don't need to centrifuge. Basically, I can just aspirate the stem cells, and I can straight go and inject in the tissue it needs to be injected. It's a difference of the needle we use. So I have the special needle, so I don't have to, centrifuge this. So no extra time there. Adipose tissue harvest, getting the stem cells from the adipose tissue or fat. That's another common thing. Usually we get in the belly or the flank area. So there's with a special needle, basically you aspirate the adipose tissue or fat. And then there are different methods to get some stem cell fluid from here. It's something called adipose washing. Basically just go through the different filters to wash it out and get the adipose tissue. Gravity sedimentation, you just leave them hanging down and basically it separates. Here is all your lipids or oils that needs to be discarded, and you get the little bit of thicker volume here, or the fluid that has lots of stem cells. Or you can centrifuge it like PRP on bone marrow stuff. Or physical separation. There's a vibration device that can just vibrate and separates the lipids and the bone marrow thing. These lipids and the oils you have to discard. You cannot inject because there's a toxic. So when you get the stem cells from the adipose tissue, you need to get the true stem cells, you have to have something called stromal vascular fraction. And that's usually obtained by digesting the fat using enzymes or very high range of vibration. Those stem cells are really stick inside of the fat, so they are not easily come out. So either you have to digest all the fat by using the enzymes, or you use very high range vibration. So these methods are considered more than minimal manipulation of the stem cells. Means you are really manipulating those stem cells, and that's against FDA rules. So you cannot use enzymes or very high range vibration to get that fluid, because that's kind of against the FDA rules. So you can get in trouble. So adipose derived stem cell therapy is kind of in a gray area. Some clinics uses this, but they do under research. So they they are doing some kind of research. So they kind of cover, but they are really not. FDA can go after them and say you cannot use that. And about 2 months ago, FDA is cracking down on the stem cell clinics because they are using these methods, plus they are using this to just treat anything, and it's not appropriate. So they are shutting down lots of clinics over the all United States. So PRP and stem cells, things to avoid or limit. So before the procedure, we usually avoid any steroids or anti-inflammatory medication, because steroids and anti-inflammatory medication can inhibit wound healing. So they can also interfere with the function of the platelet-rich plasma and the stem cells. The way it works, platelet-rich plasma, when you inject the platelets, they lyse and they release lots of growth factors. The first portion of the process is inflammation. So they're going to generate the inflammation first. The stem cell will do the same thing. If you use the steroids or the anti-inflammatory, you're suppressing that inflammation, and then those platelet-rich plasma stem cells may not work. Inflammation is the key for the healing. As I said, when you have the scratch on the skin, the first thing you notice that it starts getting red and like warm and hot. That's inflammation coming. And that inflammation leads to invitation to more blood vessels, more blood, more stem cells coming from other areas, growth factors, and then they start forming the collagen tissues to heal that cut. Local anesthetic and contrast may be cytotoxic. Platelet-rich plasma means when you do the platelet-rich plasma, local anesthetic and contrast dye is okay. It doesn't affect the platelets. When we do the stem cells, we don't use we don't mix with local anesthetic, or we don't use contrast dye, because it's definitely toxic to the stem cells. I mean, they're gonna kill the stem cells if you use together. Antibiotics may also be cytotoxic, so we don't mix stem cells with antibiotics either. Now you can do the local anesthesia for the skin before you put the needle, that's fine. But we're talking about not mixing up. Contraindication, very common. If someone has a cancer in the particular area where you're going to inject, obviously you're not going to do any injections. Anticoagulants, you have to make sure, depending upon what structure you're injecting, either you stop anticoagulants for a few days before the procedure. Some of the areas we don't stop. Let's say if you're doing the injection in a lumbar disc, we have to stop the blood thinner because you don't want any bleeding in your spinal area. That's going to be hematoma, and it requires urgent surgery. But if you're doing in some small tendons, or if you're doing in the joints, there's no need to stop. Local systemic infection, if someone has infection, obviously you don't do. So these are the kind of just common contraindications, nothing specific. So what are the protocols before we do the platelet-rich plasma or stem cell injection? Pre-injection protocol, again, we ask them, patients to stop non-inflammatory medications like ibuprofen, Motrin, Aleve, naproxen, 1 to 2 weeks before the procedure and 1 to 2 weeks after the procedure.
Question about your previous slide.
Yeah.
You had the contraindication of severe osteoporosis. So supposing you have osteoporosis in the knee, does that mean you wouldn't be able to use stem?
But the stem cell works. That severe osteoporosis goes more when you try to get the stem cells from the iliac crest. You have to be careful, right? Your bones are thin, so you can easily pierce through the bone. Okay. So then we have to kind of decide which source or which way we're going to use it. But severe osteoporosis is not direct contraindication to the stem cells of the PRP. Now PRP or stem cells, so far the research hasn't shown that it's going to make the osteoporosis better. So. What to expect afterwards? Once you do this procedure, it's normal to feel very sore for up to 2 weeks after the stem cell therapy. It's again because of the inflammation, because platelet-rich plasma or the stem cells, they're going to generate the inflammation first to start healing process. For the first 48 hours, you should rest the area and use as tolerated. Just take it easy. If you don't even have pain or increased pain, that doesn't mean you start torturing that area. You still have to take it easy. For the next 2 weeks, you should perform light stretching and range of motion exercises. So it's not bed rest, but take it easy. If you before the procedure you're doing all those strenuous stuff, you need to stop. Just you have to get the rest to your area there. 2 weeks after the injection, you start begin strengthening exercise in the direction of your healthcare team or physical therapist. If you know all your home exercise, you can start slowly and progressively get more strenuous. It takes about 8 to 12 weeks to get the maximum results. So the way it works usually, it's for first 2 weeks you may feel increased pain. After 2 weeks or around the 2 weeks, you're gonna start your pain is to the baseline like before the injection, and you feel, oh, it didn't work. That's the normal natural history of this treatment. And then you have the improvement in the fractions. So compared to the steroid injection, once you inject the steroid, your pain or symptoms will get better within 7 to 10 days quickly. And then you don't feel any pain until the steroid wears off. In this case, you may still feel some pain because of fractional improvement. The way I have seen in my patients is they come back after 2 weeks and they say, oh, it didn't work. So obviously I tell them like it takes time. And then I see them back, and after a month or 2 months, they come back and they say, wow, I didn't even realize I was doing a particular activity that I was not able to do. I didn't feel any pain. So you may not realize you already have the pain gone until you focus on that. But you're not gonna see everyday improvement. Like you're not gonna notice that. It's like every 4 weeks, 6 weeks, you will see improvement. So it may take up to 8 to 12 weeks. May require additional 2 to 3 treatments. Depends upon how severe your pathology is from the beginning. We usually don't repeat the treatment for another 8 to 12 weeks because we have to give the time for 12 weeks at least to see how much relief you got. Maybe at 6 weeks, nothing, but in the next 2 3 weeks, you see the significant improvement. You may not need the treatment. Stem cell therapy usually combined with PRP injection, depends upon where we're doing the injection. If you're doing in the large joints, you can inject PRP and stem cell both. That can help more because PRP is kind of sticky fibrous net fluid, so it converts like network, where the stem cell fluid can just attach that and stays there. But at the same time, if you inject in let's say lumbar disc holds very small volume. So we may not inject PRP, we just inject the stem cell thing because we want to inject as much as we can instead of PRP. But if you think that the disc is leaking, then we may put a little bit PRP so the stem cell we inject is not leaked out. So it all depends upon where we're injecting, what are the situation of that particular pathology. So this is we call stem cell farming. The stem cells are the seeds. PRP is and the growth factor cytokines are the fertilizer. Surrounding tissue is the soil. Vascular supply is the rain or moisture. And that leads to regeneration, healing. That's your desired crop. Without seed, fertilizer, moisturizer, or good soil, there is likely to be no crop. So sometimes you have to combine everything. So you inject the stem cells. Those are your seeds. PRP helps as a fertilizer along with the stem cells. The surrounding tissue, again, you have to have some tissues to regenerate, right? If you don't have anything left over, you cannot regenerate. So someone comes with a severe pathology where there is nothing to regenerate, it's not going to regenerate. It's not going to form completely new stuff. So you need that. Vascular supply, that's where the PRP stem cell comes into play because they will lead, as I say, that angiogenesis, formation of new blood vessels. So they will bring new blood vessels and more growth factors to get more fertilizer there. Stem cells, PRP also will help to basically get rid of those scarring, all adhesions, scar tissue and everything, they will chew it. Because as they get more bloods, there's something called macrophages. These are another white blood cells. They will come and they basically digest all those scar tissues and everything, and the normal tissue. And this is the reason it takes 8 to 12 weeks for the full response. So usually what we use for this treatment for osteoarthritis of the joints, any tendinopathies, sports injuries, sacroiliac joint pain, degenerative disc disease, disc bulging, HNP, facet joints, carpal tunnel syndrome, piriformis syndrome, and these are the some of the list. There's a variety of more pathologies or more diseases you can use this, and we're talking about just the musculoskeletal here. So just showing some pictures. You can inject in the shoulder joint is right there in the ultrasound guidance. Rotator cuff, very commonly you will see how people have this shoulder pain. This rotator cuff has chronic inflammation. In the layman term, we'd say the bursitis. Bursitis is the acute inflammation. Means you have just the pain for 2-3 days, 4 days. If you don't treat well, that acute bursitis or acute tendinitis becomes chronic. And chronic means there's a chronic inflammation, there's a scar tissue forms, adhesions forms, and there's a chronic inflammation and it continuously hurting you, never gets better. You do the cortisone injection, steroid injection, it definitely helps, but doesn't help forever. It works for 4 weeks, 6 weeks, starts coming back. You inject steroid again, it works, but it come back. And the reason is that steroid is just temporarily getting the inflammation down, but that that scar tissue is right there. It doesn't get better with the steroids. So with the PRP stem cells, obviously you're going to get rid of all those scar tissues, formation of the new tendons and the tendon fibers, and so eventually it heals, totally healing. We use for the tennis elbow, golfer's elbow, hip tendons, hip joint itself, greater trunk bursa. We call greater trunk bursa, and we always call in the layman term again the bursitis. The patients who has greater trunk bursa pain chronically keep coming and not getting better with the steroid injection or works very temporarily. We do the MRI and we always find there is a, you will see in the MRI finding they will say tendinosis or tendinopathy or partial tear of the fibers. That's all telling us is just chronic inflammation with lots of scar tissue in that, and that's why it doesn't get better. Achilles tendon, either is chronic injury or you can have the acute sprain strain. You can do the platelet-rich plasma injection to help that. And when we do the injection in the tendons, we do something called tenotomy. Tenotomy means we just use the needle and we make a few passes through that damaged tendon, just break up some of the tissues to help promote the healing faster. Knee joint, plantar fascia, ankle joints, foot joints, hand joints. Obviously the big part is the back in the disc. PRP is also used for the aesthetics, big time now. There's something called vampire facelift. They use everywhere for the lips and you name it, wrinkles. Current uses, they use for the hair loss and acne scars and skin, get the skin better, hair restoration. So you have to fertilize your lawn to get the hairs back. It's also been used for the sexual health. The lots of sexual dysfunctions, you can use a platelet-rich plasma to make it better. Wound healing, lots of patients who have a chronic wound that's not healing, that injecting platelet-rich plasma, and it really heals very quickly compared to prior. You know, you go for plastic surgery and do the flap to cover it, and again it breaks because of the pressure, but the PRP has changed the whole game. I cannot treat that. So just quick, who uses PRP stem cell therapies? Before even really came in the picture, like the common public started come to know about these PRP stem cells, all these people has used. Yeah, he had acute Achilles tendon injury. They did platelet-rich plasma injection, and I believe within 4 weeks he was back on the court. He did cervical spine, I believe in Germany. Obviously, she did. There are some of the articles I just put it just to show that this is not just the hoax, it does work. More articles coming out that it's working more and more for the musculoskeletal. So the gluteal tendinopathy, that's we commonly call the hip bursitis. Hip joint arthritis, lumbar facet joints, intradiscal, where lots of articles coming out that it really works for the lumbar disc problems, discogenic pain, we call. It has been treated very well in the knees, mesenchymal stem cells. Those are the stem cells in the knees, or PRP. All these studies showing that there is a significant improvement in the function. And actually, they have seen on a sacroiliac joint, they have seen the reversal of the osteoarthritis. And one of the lecture, I was one of the pioneer of the regenerative medicine. The way the regenerative medicine going, he says within next 10 years there's going to be no joint replacement. So there are the studies for the hip joint arthritis. They did MRI before and after the treatments, and they actually see significant improvement in the hip joint with less arthritis and increase in the joint space. Yes?
Can you treat two sites in the same session, like a hip and a knee, or
Yeah.
would it be better to do it in 2 sessions?
No, you can do both.
Are you asleep while all this goes on?
It's up to you. We can just give you nothing, Valium, or you can go to sleep. There is no contraindication for anything.
And does one treatment usually work?
As I say, we do one treatment, wait about 12 weeks, 3 months, before we decide whether you need the second one or not. With the platelet-rich plasma, sometimes they require the second one, and then most of the time when you do the 2, it can last longer. Now, one thing you have to understand, that once you do the PRP stem cells and you regenerate the tissues, that doesn't mean it's permanent, because body loses, right? Body degenerates. That means if you regenerate the tissue by doing injection, then you have to do exercise and everything to maintain it. If you don't maintain it, you're going to go down the hill again the same way it happened before. So they say, the study says when you do 2 PRPs, it may last 2 years, 3 years, unless you maintain it. Yes?
Determine who a good candidate is and who is not a good candidate for stem therapy.
Well, it all depends upon, we have to get the X-rays, MRIs, and see and where the pain is coming from. So for example, if someone comes and say, hey, I have the back pain going in the leg, and I want to get better with the stem cell, there are 2 scenarios. You can have pinch numb in your back because of the disc herniation or disc pushing out, and your pain is getting worse. That's a great candidate to have the injection done and get, you can get better, because the disc gets better, you can have pressure away from the nerve gets better. If someone has that sciatic pain because of the pinch numb, because of something called spinal stenosis, where the narrowing of the hole is so bad from the bone spurs and the thickening of the ligament, obviously that's not going to get better by putting anything in the disc. Disc will get better, facet will get better, but the narrowing of the hole is not going to get better. That bone spur is not going to go away. We don't inject in that bone spur. We don't inject in the epidural space yet. There is no studies yet, and they are not sure whether it's safe or not. So, different scenario. It depends upon where the pain is coming from and what's causing the pain. As I said, someone comes with a knee arthritis, and there's a severe knee arthritis with almost no cartilage left. I'm not sure we can help with the stem cells.
Do your platelets have to be normal before you do PRP? Too small, not enough?
As long as the platelets count is normal, it's okay. So if someone has very low platelets, obviously it's hard to concentrate. So if you centrifuge that, you're still not gonna get 4 times the normal. Does it still work? Yes. Does it work as much as 4 times? No. At the same time, the studies also says if you do the platelet-rich plasma and the concentration is more than 5 times, it's actually injurious. It causes damage. So the way that you use the machines and everything, the machines are basically prepped, or it's ready to do only certain concentration. Yeah.
What if you had too many platelets? What do you do?
That's good.
Well, you said if it's too much, it's dangerous.
Well, but you have to dilute it. You
what?
dilute with your plasma.
Oh.
Yeah, there are some machines you can actually they have the settings. You can choose how much you want, how much platelets you want.
To his point, if you don't have enough platelets, can you take donated platelets from somebody else, from a family member? Or do
Yeah,
you
but
only use
that leads to all
colleagues?
those type and cross match,
Right.
and actually you cannot do it because that's called transplant, outside transplant. So that's against FDA. The only thing you can use other person is usually the people uses the amniotic cells or the placental cells. That's ready-made, is available in the market. You can buy and inject. They have already have been treated with all those, making sure you don't need that type and cross match and everything. It's like blood transfusion.
Is that approved by the FDA,
Yes,
the embryonic?
not embryonic.
Hmm?
Not embryonic, placental or amniotic fluid.
From the amniotic?
Right, not embryo itself. So the placental, they take from the mom side. Placenta has 2 sides. Baby side and the mom side. So they use the mom side one. Or the amniotic fluid, because they have lots of stem cells. But the research says when you use those things, it's really not the stem cells. It's more growth factors inside that helps you. There are almost no stem cells left. When you inject the stem cells in these tissues, they probably alive for 2 to 3 days. They don't alive all the time, but it's just they start this cascade, like multiplying and everything. So original stem cell dies.
What about insurance?
None,
Okay, nothing.
not yet.
And what is the cost?
Who's here?
Anybody can go in.
I'm just gonna say what I say always. The PRP is like a Kia. A stem cell is a Lamborghini, cost-wise. Our cost is, I would say, PRP at one side is around $950. I think we are the cheapest in Florida. And stem cells, it starts about $4,000 per site. Any questions?
I'm missing about 60% of the cartilage in my right knee. I don't have any pain at all associated with that. Could this grow back that missing cartilage?
Yes, it will regenerate more cartilage. But if you only 10% left, I don't know. Does it still work? PRP stem cell? Yes. It's not going to regrow, but it will help to reduce the inflammation from the osteoarthritis. So it will work, but it may not work too long. Does it work more than steroid? Yes. There is a 6 months ago, I believe, the report came out in New England Journal. The article came out, and they did a study. They did the steroid injections every 3 months in the knee joint, and they did the MRI before and after, 1 year after, like 3 or 4 injections of steroid in the knee joint. the knee joint was almost destroyed. So steroid helps, but it also destroys the joint. It destroys the cartilage. Same thing with the tendons. Like if you keep injecting for like hip bursitis, if you keep injecting steroid, it will help. But it's also causing more and more scar tissue formation from the injection and from the medication. So you have original scar tissue, but you're getting more tissue from that. Until now, we didn't have anything but steroid. So we keep injecting steroid to help patients, but now we try to offer them like, hey, this is the best thing to do.
You said that within 10 years there probably won't be joint replacement.
Correct.
Now if you currently have bone on bone.
This might not help.
Pardon me?
No, wait, I'm talking about the people who already have the bone and bone. They're gonna require the replacements.
Oh, okay.
Right.
At this current time.
Right. But the way it's going, like they're gonna able to grow your cells more often, and they can inject it. But you have to start at early stage. As I said, there is no cartilage left. I mean, you cannot regrow anything.
You listed a lot of things that PRP can fix.
Correct.
Does each doctor of that discipline, like a gynecologist, would learn to do stem cells, or you go to a stem cell doctor?
Well, it depends. Like there are some institutions, they have this doctors in their network, and they do the stem cells for their own specialty, like urology, cardiology,
So
pulmonary.
you're going to a stem cell specialist. I understand.
Right. So the musculoskeletal is easy, like
Yes.
physical physiatrist or the orthopedic surgeon or the pain management can do the musculoskeletal PRP stem cells. And there is lots of research going on, and lots of people is getting stem cells for the face aesthetic, dermatologist, plastic surgeon. I can do it. There is no anything, but if like someone wants to do the heart, there's lots of studies going on. Lots of people doing the stem cells for the cardiac disease, heart disease, for the pulmonary disease. There is actually they do IV infusion of the stem cells to help those things. Obviously, you have to go to those specialists, and not all pulmonologists does that. Then you have to go like specialty clinic who does that. Eventually, everybody's gonna do it probably. Again, is a cost, and availability is an issue still. To do the IV infusion, you cannot do the bone marrow aspirate. You cannot do IV infusion because you have lots of stuff there. You cannot inject IV. So for that, you have to get that stromal vascular formation from adipose tissue. Again, it's not FDA approved yet, so you have to go to those special centers where they are covered or under research.
How long has this therapy been utilized?
I would say this is going on for last 10-15 years, but it has been in the widely coming in the publics for about 5 years, and it's growing very, very faster. And it's working so well that recently I think the Senate and House about to pass the bill to expedite the stem cells. We cannot still do this culture here. In the Europe and in UK, they can take your stem cells and they can basically do the colony formations. So from one stem cell, they make them millions and billions, and they can inject those to you in your body. It's not allowed in the United States yet.
Oh, it's just a matter of legality.
Correct. But there's always like Europe always goes first, and we follow them after 10 years.
Same thing with any kind of new medicine, wait forever.
Correct. They are growing the nose and ears for the veterans who lost their stuff. So
I've had a torn meniscus. Does that preclude this therapy?
it depends upon where you have the tear. There's in one area you have the tear, there is no blood supply, so you may need more treatments, and probably the stem cell will be the best compared to the PRP.
What's the difference between PRP and stem cell? I guess maybe I missed that. I thought they were pretty much the same, but obviously they're not.
Platelet-rich plasma is just the platelets you're injecting, one of your blood cells. So they do work to get rid of the inflammation, release the growth factors, and they can also sum up your stem cells from the other part of the body here, but not in the abundance. The stem cells are very potent. They are very effective. So your tissues are made out of the stem cells. Every tissue are the stem cells of that particular tissue. So muscle has all your muscle stem cells. But if they are damaged and your body is not able to get those stem cells from somewhere else to repair that, when you inject the stem cells, they really work very hard and very fast to regenerate the tissue. Platelet-rich plasma is not going to really regenerate the tissues. It's going to help to regenerate. But the stem cell is going to regenerate. So that's the difference.
What about pinched nerves?
If the pinch nerve is coming from just the disc pressing on it, the stem cell will, or the PRP will work. But if the pinch nerve is coming because of the pressure from the bone spurs, no.
Does it help peripheral neuropathy in the legs?
Not the local injection. For that, you may have to go for like IV infusion things. And those all IV infusions things are still in the research stages. So you have to sign up for the research, and they do that. But those were, I think you have to go to those stem cell research centers or the academics. I don't think there's anything local people do it. The local injection won't help for the neuropathy. They are working, and they have shown if someone cuts the nerve, they can repair it and inject the stem cells around there. It helps to regenerate that nerve quicker, faster, and normal.
He's been diagnosed with the neuropathy in his legs. I just wondered if it would help his walking, balance, any of that.
Maybe the IV infusion treatment.
Do they do that anywhere here or no?
Not in, or I don't think so. I think in California they have.
California?
Yeah.
It's a long way out. Sure is interesting.
Very good. Thank you very much for coming.